Hello, and welcome to the Harlingen Consolidated Independent School District in Valley Baptist Health System Education Talk. I'm your host, Joe DeLeon. Did you know that stroke is the fifth leading cause of death in the United States and is the number one cause of long-term disability among adults? With a nearly 90% Hispanic population in our region living with type 2 diabetes and hypertension, it makes people here about 6 times more likely to suffer a stroke than the average American. These statistics place our population at risk, and it's important to identify a stroke early on, understand how to prevent them, and know what resources are available to anyone who experiences these signs and symptoms. Today, it's my pleasure to welcome Dr. Ameer Hassan from the nationally recognized and award-winning Valley Baptist Neuroscience Institute, part of Valley Baptist Health System, which has been serving our community for nearly 100 years. Dr. Hassan is one of the most respected and highly sought-after physicians in our community. He is a triple board-certified neurologist and is the head of the Valley Baptist Neuroscience Institute. Dr. Hassan is a graduate of Rowan University School of Osteopathic Medicine and has been practicing for more than a decade. Dr. Hassan, thank you so much for joining us here today. We're excited to have you. And let's just go over the first question. For some viewers that may not know, what is a stroke?
So thank you for having me. And to start off, stroke is when you have a blood clot in a blood vessel in the brain. And typically you develop some sort of deficit, and we can go through some of the deficits.
Awesome. And so there's multiple types. And
Correct.
So can you just list some of them?
So ischemic stroke is the most common. 87% of all strokes are ischemic, and that's the blood clot in the blood vessel. And then you have another 10 to 15% are intracerebral hemorrhage. That's typically caused by high blood pressure. And you just get a burst in one of the vessels in your brain, and you get a lot of blood. Those are pretty deadly, and that's why we recommend controlling high blood pressure. And then subarachnoid hemorrhage, which is typically caused by an aneurysm. The aneurysm is like a ballooning of the vessel wall, and then it pops, and it causes blood in the subarachnoid space. And that is about 3% of strokes, and there's about 800,000 strokes here.
And so you were talking about hypertension.
Yes.
How would one know if they had hypertension that could lead up to a stroke?
So assuming you visit a doctor once a year, you would know if your blood pressure is above 120/80. And nowadays, anything above 120/80 is considered hypertension.
And so you recommend seeing a doctor at least once a year?
Yes.
Awesome. And so who's more at risk for a stroke?
So unfortunately, we are very busy as a per capita stroke center. We are probably one of the top 5 in the country because of our patient population. And it's very unfortunate. That's why we're doing this today, right? We want to educate the public. So we have a very, very high rate of high blood pressure, hypertension, diabetes, and obesity. That combination significantly leads to increased risk of heart attacks, myocardial infarction, MI, as well as acute ischemic stroke. And because of those medical risk factors, not only are you at increased risk of stroke, but you're at increased risk of a poor outcome after a stroke.
So let's just talk a little bit off topic about what may lead up to these stages. What lifestyle would one choose?
Great question. So lifestyle is the issue. It's lack of exercise and high carb, high fat diets. So that's why we always recommend you should eat more fruits and vegetables. Cut out red meat, cut out pork. Chicken, if you're going to have it, shouldn't be Kentucky Fried Chicken. It should be grilled or baked. More vegetables, right? More vegetables and fruits in your diet. You should be walking and exercising. So if you're, 75 years old, you're not going to be running a marathon. I mean, some physicians do, but in general, most of the population should try to exercise at least 30 minutes a day, 6 days a week. And walking around your neighborhood, unless it's a fast-paced walk, it doesn't count. So it's got to be a fast-paced walk, but it should be exercise. Swimming, jogging, fast-paced walk if you're limited due to your joints or something like that. But the younger generation is the problem. With COVID, we've never had young strokes like we've had today. Oh, wow. We had patients in their 20s and 30s come in with stroke, 40s, 50s, where the average historically was upper 60s, low 70s. So there was a big shift in stroke due to COVID-19. And it was probably a combination of things. We do believe COVID-19 did cause more blood clots to be formed in your body. And that was part of the issue. You were getting blood clots in your lungs and throughout your body. You got a specific type of stroke, which is a venous clot instead of an arterial clot. And then on top of that, people were home, they weren't going to the gym, they were using any excuse to just Netflix binge, right?
And so physical activity does not just play a factor. It's also eating healthy fats, and eating the right. Yes, it's a perfect combination. And so let's just talk a little bit about the symptoms one may experience if they're having a stroke, because people may not know, like, hey, this is what I'm experiencing. I've been experiencing this, for the past couple of hours,
Yes, so that's a great point, because most strokes, when I first got here, it's going to be 9 years, July 8th, most strokes don't come in through EMS, through the emergency room. They want to sleep on it. They think they're going to get better the next day, or they try to drive themselves in and then they go to a non-stroke center hospital, which then delays care even further. So the AHA came up with a great acronym. It's called B FAST. So B is for balance. If I'm having balance issues, I should probably go to the emergency room. If I have eye issues, double vision, blurry vision. If I have facial droop, F is for facial droop. So if it looks like your face is a little crooked, definitely call 911, get to the closest emergency room. A is for arm or leg weakness. So if the patient has weakness in the arm or leg, it could be one side, both sides. Typically it's unilateral. Again, call 911. S is for slurred speech. So slurred speech, trouble speaking. And then T is time to call 911. And the reason we want people to call 911 and not just drive themselves to the hospital is 20 to 30% of what should be done is done by EMS up front, right? Airway, breathing, circulation, doing the ABCs, and then they know who's the comprehensive stroke center, who's the primary stroke center, and they'll get you to the right location as fast as possible.
That's fantastic. And I know how you mentioned time. Time plays such a crucial role in doing this. So what can one do to prevent the long amount of time in between having a stroke and getting to the intensive care unit?
Immediately. That's what's extremely important. The IV medication that is FDA approved for stroke treatment is only approved up to 3 hours. Based on some guidelines, we do give it up to 4.5 hours. Mechanical thrombectomy initially was approved up to 6 hours, and now, because of the DAWN study and Diffuse 3, we can treat patients up to 24 hours. And with mechanical thrombectomy, we take these devices through either a tube through your wrist or through your groin, and we basically go up into your head and try to trap the clot or suck it out.
Oh man, and so you definitely do not want that happening to you, and preventing it as much as possible.
You don't want to meet
unless
you have a stroke.
If you come into my room, I'm definitely going to be concerned. No, and I have a little face drooping right now, but it's because I was at the dentist earlier today, so no alarm there. But age is very important, right? Because I mean, you were talking about it right now, how 20-year-olds are going in for stroke. So does age play a factor in this?
There's a chance of a good recovery, because the younger you are, you have what we call neuroplasticity. So your brain can remove functions and move them around and reconnect things. When you're 80, that's not going to happen. When you have a stroke in your 40s or 50s, you're more likely to recover because of that neuroplasticity.
And so what services are available at Valley Baptist that would, get one who had a stroke and is in recovery back to a normal lifestyle?
So we're a comprehensive stroke center. So we have everything from when a patient comes in through the ED, we do the appropriate workup, we do the appropriate scans, we have advanced imaging, perfusion imaging, we use artificial intelligence to analyze our images. We work very closely with Viz AI, and we've improved that algorithm. A lot of our research has shown significant improvement in outcomes, length of stay, and especially in the hub and spoke model, like our sister hospital, Valley Baptist Brownsville, we're able to get those patients in faster and treated faster because of the artificial intelligence. Then we have a cath lab. So we have 3 biplane suites. We're the only, actually probably south of Houston. I don't even think San Antonio or Austin have any of their comprehensive stroke centers with 3 neuro labs. So we have 3 biplane suites. Then we do the appropriate procedure to fix whatever the problem is in the patient. Then we have a 10-bed neuro ICU we're expanding now. We're getting a 14-bed neuro ICU expansion. We also have a step-down unit. We have a stroke unit. So you're getting the appropriate care post-op. You're getting the appropriate workup done in the stroke unit with, echo, ultrasounds, MRIs, whatever needs to be done to find out why you had the stroke. And then before discharge, it's that secondary stroke prevention. Sir, you have severe carotid disease. We're going to stent you, or we're going to stent you in 2 weeks. This is the reason for your stroke. Or you have an abnormal heart rhythm. You now need to be on blood thinners. Or you just have small vessel disease. which is probably caused by bad diet and lack of exercise. So we highly recommend you exercise and improve your diet. And then for those patients who can't go home, they need rehabilitation, we have state-of-the-art rehab center that we're bringing virtual reality to very soon. So we will be one of the first in the state of Texas to introduce virtual reality in stroke rehabilitation.
So the RGV, they're taking great lengths, especially Valley Baptist Medical Center, to help these individuals that are either suffering a stroke, but also reduce the risk of a stroke.
Yes, no, we do. Valley Baptist has done a great job trying to stay at the forefront of stroke research, stroke technology, and rehabilitation.
That's fantastic. And so let's talk about, let's say somebody is suffering a stroke, the symptoms of a stroke, and they've already called 911. What else could they do in that moment to kind of, assist the person or, help them out, the individual that's having a stroke?
So I always give a talk to the public about stroke symptoms and whatnot and what to do. To be honest, the best thing to do is call 911 and just stay by them and just, hold their hand and that's it. You don't want to give them aspirin because how do you know, you don't have a CAT scan, you don't have x-ray vision, right? You don't know if it's a bleed or ischemic stroke. Ischemic stroke, aspirin might help, but if it's a hemorrhagic stroke, it will make things a lot worse by giving them aspirin. So there's really nothing to do, just calling 911 and just making sure that you, for example, get their meds ready so that when EMS comes, they know what medications the patient's on. Making sure that you know when the last known well time is. That's extremely important because of the IV drug I was talking about earlier. That drug can only, the FDA approval is for 3 hours. So you want to make sure the patient had a stroke. I saw my grandmother normal at 3 p.m. I came in at 5 after playing basketball and she's on the floor. So last known well is 3 o'clock. And then I get the bag of medications and I go with her on the ambulance to the hospital.
And that's fantastic information because one may not know and they may be trying to treat an individual and,
yes, unfortunately we've seen it a few times.
And it makes it worse, right?
Yes.
It does make it worse. So is there a survey or a tool that one could use that could help determine if somebody is having a stroke or at risk for stroke?
So again, American Heart, American Stroke Association has come up with a quiz questionnaire survey type deal. The website link was made available and hopefully you guys can show it on screen. And it asks simple questions, right? Family history, for example, high blood pressure, diabetes, whether you exercise or there's lack of exercise. And basically, it will categorize you into high risk versus low risk.
That's fantastic. Is there any last words of wisdom that you would like to impart on the viewers here today?
So again, I highly recommend everybody learn BFAST, the acronym, what it stands for, and teach it to someone. Because if we could do this for an aunt, an uncle, a friend, a grandparent, and get them to a hospital much sooner, that significantly improves their outcome. The faster we treat, the faster the patients improve, the better they get. We lose 2 million neurons a minute when we're having a stroke. So it really is a big deal to know the symptoms, know the signs, call 911 immediately, get to the closest center. If you're in Harlingen, it's Valley Baptist. We're the Comprehensive Stroke Center, considered one of the best, top 20 stroke centers in the country. And also, I would highly recommend start from today, right? If you're not that active, start getting active. You should exercise and raise your heart rate at least 30 minutes a day, 6 days a week, and just try to have like a meatless Monday. Try to just get rid of the fatty fried foods out of your diet and try to eat a little bit healthier, more fruits and vegetables. Instead of snacking on Doritos or Tostitos with salsa in the middle of the night, try to bring.
Making me hungry here.
Yeah, trust me, I'm thinking the same thing, but bowl of strawberries, bowl of blueberries, have an orange. I think introduction of fruits and vegetables more often as a snack, I think would make a big difference in our lives if we start early, right? If we start in our 20s, 30s. I'm 41 now. I'm getting old. But when I first moved here, I was 32, right? And my wife just had a baby, and we consider Harlingen our home. I had a son born here. Both my kids go to school here, and it's extremely important to know that their friends, their friends' parents, all of my friends understand signs, symptoms, and try to take care of themselves. Because if it's not a stroke, it could be an MI, right? A heart attack. So eating healthy and exercising really makes a huge difference in your life.
And so hopefully, some of these viewers take some of that with them today and change a little bit of the lifestyle. It's very important. Very, very important. And I just want to go back to one certain thing. You mentioned neurons. And 200 neurons you lose per minute, correct?
2 million.
2 million neurons.
2 million.
That's a lot of neurons. Oh my gosh.
That's why it's extremely important to. Now, our body has a safety mechanism. We have collaterals. So when I include the carotid on the left, the right side starts feeding that part of the brain. But those collaterals only last so long. So people who are fast progressors, their collaterals might last only an hour or two. So if you don't give them the clot buster within 1 to 2 hours, if you don't pull that clot out, they're going to have deficits for the rest of their lives. And then the slow progressors are the patients that we studied in the DAWN study. So we were a site, we were number 6 enrolling site in the world. And based on that data, now we know with perfusion imaging, we can find out how much tissue is dead, how much is alive, and if there's a big chunk of alive tissue, we still take that patient to cath lab up to 24 hours.
So act fast. That's the number one key. Every minute counts. Well, thank you, Dr. Hassan, for talking to me today.
Oh, my pleasure.
Really enjoyed our conversation. And so thank you so much for that. To learn more about stroke, we invite you to visit the American Stroke Association website at www.stroke.org. Also available 24/7, please visit www.valleybaptist.net to learn more about your health and wellness, including available services at your Valley Baptist. I'm Joe DeLeon. Thank you again for watching this edition of Harlingen CISD and Valley Baptist Health System Education Talk. You can watch this program on KHGN's YouTube channel, or you can also download and share this program on the Valley Baptist Facebook page. Just look for them on Facebook at Valley Baptist Medical Center. Thank you so much. We'll see you again next time.